and just go through two illustrations of studies which aren't short people's microphone moved. Don't have well-being as explicitly measured, but I want to illustrate two different approaches to evaluation, one the randomized trial and one the well-being measure, one the modelling approach, and then show you a tool that can be used. And the other thing, I'm just sitting there looking at my new watch, which I like when I go running, and it's got a heart rate monitor. I noticed that in the last 4 hours, my pulse was as low as 39, but during my previous presentation, it hit 139. So that's probably a very crude indication of well-being. I'm not sure it's positive or negative. Anyway, I don't know why I said that. So, two examples. I want to talk you through here. One using a randomized controlled trial, which in fact is an evaluation of a CBT, cognitive behavioural therapy type of intervention, and one which is a modelling study which has just been published by Public Health England from work that we did. So what I've talked about, those are two of the approaches that I've referred to previously, and I just want to give you these two examples. So the randomized controlled trial, I said earlier, if you were doing most clinical trials in the health service space today, you wouldn't get any change for £1 million, I think, from randomized controlled trial, certainly in the areas that I work in mental health, in dementia. And so these are expensive studies. They're very, very powerful, but they are expensive and they take quite a long time to do. But let me just illustrate one and how that feeds into some of these issues about how we decide whether an intervention is cost effective or not. And this is a form of computerized CBT. CBT is wonderfully effective, as Paul was saying, and it can be quite straightforwardly converted into a computerized therapy given how structured it is as a psychological therapy. And this is an old form of psychological of computerized therapy. There are much better ones now, I think, but this is the evaluation that we did more than 10 years ago now. We published the papers. So what this was is it took people with depression and or anxiety, randomized them to just their standard support from GP and medication and so on, or that standard support plus going along and getting these 8 sessions of computerized therapy. And so the evaluation we're looking at, is it effective and is it cost effective? Now on the effectiveness side, the clinical people in the team had these 3 measures, very familiar measures of depression and anxiety, the Beck Depression Inventory and Beck Anxiety Inventory, very widely used, and also a quite widely used measure of work and social adjustment, which is around personal functioning and workplace activities and so on. So very straightforward measures, predictable effectiveness measures you would find in this area, and the beating the blues, the computerized therapy, was absolutely clearly more effective than the treatment as usual on all 3 of those measures. Now, what we also wanted to do, and I'll show you why in a moment, was to turn those into something slightly more intuitive, because I don't go around, I'm not sure about you, but I don't go around thinking in terms of my Beck Depression Inventory score, but I might think in terms of whether I'm feeling pretty miserable or pretty rough today. And so we turned that measure, it's just taking the measure over time, into the number of depression-free days that people had over the 8-month evaluation period after randomization. And you can see the difference, 90 days compared to 60 days. And then we also converted those into a quality measure, because NICE were interested in the results of this evaluation for a guideline they were writing on computerized mental health treatments. And you get a small quality gain, it's actually quite important, but a small quality gain over that 8-month period. So those are the effectiveness results. We have something which is more effective than what we do at the moment. Now on the cost side, we're in a situation where we're not quite sure whether it's cost effective. And what I put in there is the mean difference in that first column of numbers between the computerized therapy minus treatment as usual. Firstly, for health and social care costs, which is what NICE is concerned with. And you can see that the computerized therapy costs £40 more, even after taking account of the fact that people used fewer health and social care services after the therapy was effective, but the therapy itself is expensive. And then we also had this measure of productivity losses in terms of absences from work, and if we followed the approach that Paul's just been showing, you could perhaps more helpfully in some respects turn that into the impact on well-being of the individual with the condition and their family and so on. So you can measure that in a well-being sense. But what we have is this, as far as NICE is concerned, we have an intervention which is more effective, but it's more costly. And the confidence interval shows that is a significant difference in the cost. So is this cost effective. What we did was to compute a range of different indicators to address that question. The first one was using this Beck depression inventory, and what we did was compute the incremental cost difference and the incremental effectiveness difference. Richard showed you the little algebra for that very first thing today. And you get £21 per unit improvement in the Beck depression inventory. And I would really, really hope that if I asked you if that was good or bad, you'd say, I have no idea. Okay? If you do know what it is, you're either a psychologist or you should get a life. Okay? So, I mean, I think so. It's sort of it's not an intuitive measure to us. Okay? We don't know this area very well. So, what we then did was turn it into this more what I call publicly engaging sense. What is the cost of achieving one more depression-free day? It's the same information as above, but it's a now more intuitive measure. It's the cost of a Starbucks coffee, not a very big one. I think that's quite low. Okay, so I'm not saying it is cost effective, but it gives us a reference point for then judging whether we think this is worth purchasing, if you like. On cost per quality, this is way below the NICE threshold, is very cost effective, and this fed into NICE clinical guidelines for depression treatment. And if we did bring in those employment effects, I measure them in terms of productivity losses in cost terms, but they could be in well-being terms, then you clearly see this is a very attractive intervention. Now, it took a lot of pounds to get to that stage with that evaluation because you have to collect data from real people over real time periods, randomize them and so on, but it's a very powerful evaluation and gives good results which can then guide that clinical activity. Now, the second example is using modelling. And this study I'm going to talk to you about in a moment was funded by Public Health England from my centre, and it cost £95,000 to do the whole study. So it's a very different order of magnitude in terms of research funding. Now, what is the purpose of modelling? It's simulating rather than going out and collecting new primary data. And I've just put up here, put them all up actually, there are 8, I think, reasons why we might use modelling. Not necessarily instead of a primary data study, randomized trial or some other design, but usually to supplement or to complement it. So the first one is it could be an alternative. We simply cannot wait 3-4 years, whatever it is, for a randomized trial to be set up, followed through, analysed, and so on. So we can do it instead of that, at least in the short term. Secondly, we can supplement a randomized trial, and we can do that in a number of ways. The second point there is saying we can follow people for longer, or we can speculate, project what will happen to them over a longer period. Some of the things that were coming up in what Paul was presenting earlier. Thirdly, we could look at particular subgroups of the population, break the data down, look at those in a bit more detail. We could explore uncertainty a bit more. We can synthesize data from multiple trials, not just one, but bring data from all over the place, which is what I'm going to show you in a moment. We can look at differences in rates of access and uptake and so on. We can look at new pathways, and then we can look at budgetary impacts. So modelling is not, as I said earlier, I absolutely firmly believe randomized controlled trials are the best way to address many questions, but sometimes we haven't got time or don't need to go with that, or we need a slightly different type of information from our evaluation. So this is a study, Public Health England published this at the end of August, and it's mainly around what works in preventing mental health problems and promoting mental health and well-being. And what we did, the general approach is to say, we can't go out there and collect new data. Let's take the evidence that's out there already for 8 different interventions I'll show you in a moment. The evidence on effectiveness, or the evidence maybe on cost effectiveness but from another country, convert all that evidence into the English context and look at the economic case. So it's using existing information from usually multiple studies, often studies from outside the UK, but where they convert into a UK context without really any problem. So these are the 8. Whole school anti-bullying program, which I'll tell you a little bit about in a moment, school-based social and emotional learning, workplace wellbeing, workplace stress alleviation, collaborative care model for people with physical health problems whose mental health issues hardly ever get picked up or treated, tackling loneliness, tackling debt, and preventing suicide. So what happened then, say, we'd taken evidence from elsewhere, and then modelling, my colleague David McDade did 99.9% of the work, modelling what the economic consequences would be. And in this case, the way we presented it is, what is the return on investment in terms of monetary gain? Usually it's in terms of savings in those different sectors, NHS, other public sector, and elsewhere, and the total I'll show you. And many of those interventions are not in the NHS. They can be done in workplaces, schools, or need to be done in other places. So these are the figures. I'm not going to dwell on the figures for very long, but you can see in many cases there is quite a return, quite a strong, quite a large return on investment. It doesn't matter if the return on investment is less than 1 necessarily, because we've already, or other people have already shown, these interventions work in terms of better health, better functioning, better well-being, whatever the measures were in their different studies. But you can get these sort of indicators of the economic return through this kind of simulation modelling. Now, what we've also done at that study, and this is why I wanted to show you this particular example, is there is an online tool which then allows people in each locality to plug in their own data to see what would be the return in their locality given the basic population characteristics that are needed to do that. And it's open access resource. So let me just quickly show you what we did on the anti-bullying one, because I think we've got some interesting results. So what we then did was say, what do we know about a school-based anti-bullying intervention that works? The best one that seems most useful for this purpose is one called Kiva, which has been evaluated in a good study in Finland and is now being evaluated in Wales. It does appear to have a range of outcomes, short-term outcome evidence there, and has impacts in economic sense on health, on school performance, on parent productivity, but there have been very few economic studies. And I put in their subsequent work because the published version of this just follows pupils, students in the schools for about 3 or 4 years. We've now just, as of last week, finished some modelling which then looks at what the effects would be up to age 50. Using actually the birth cohorts that were talked about by Andrew earlier to look at those long-term clinical and functioning and economic impacts of being bullied in childhood in school. And the economic impacts are enormous over that period. But this is the short-term stuff. And what you do is this kind of modelling. I mean, I don't expect you to read it, and if you can read it, you'll realise it's only part of the model anyway. But you do this decision tree, this simulating of the pathways that people would take through a system, whether it's a school system, a healthcare system, whatever it is. You're trying to just replicate in your Excel spreadsheet or in some bit of particular software what would happen, and then attach probabilities to those different pathways, attach costs and outcomes to those pathways in a very similar way to the simpler version that Paul was showing you just now for another context. And then what you get from this anti-bullying one, if I just sort of highlight at the bottom there, I mean, that's the sort of thing. This is my colleague David McDade, who lives in Bedford, so that's probably why he puts Bedford on his slides. But this is the replication in that local context of what the return on investment would be for decision makers. In this case, it would need to be schools who would be introducing this, because it would be teachers that would be delivering this program as evaluated, to then show what the economic returns would be. So I'm going to stop there. My 2 examples were to illustrate quite different scales of economic evaluation, very expensive but needed for certain purposes, but you can do a lot with this sort of simulation modelling of various levels of sophistication, and the simulation modelling lends itself very nicely to this both generalisation and localisation of the evidence that comes out of these studies. And well, okay, these are conservative results, but clearly a strong impact. And that's it. Thank you.
Thank you, Martin. I don't know about you, but my brain feels very overheated. There's smoke about to come out, but also very inspired by some of that and kind of eager to go back to some proper Excel spreadsheets. But don't worry, we're about to have a coffee break. I just wanted to take a few minutes to tell you a little bit about some resources and tools that we have in the centre that we're in the process of developing that might be useful for you. And then I'm going to ask you to tell me something about your own practice. And we're going to do that in just 10 minutes, and then we'll go and get coffee. So the first tool that I want to talk to you about is what we call the Evaluating What Matters microsite, and we're trying to come up with a better name. And this is a website that sits within our own website, which is a guide on evaluating well-being for a particular audience. So I'm going to talk about who it's for. It's for small or medium-sized charities or social enterprises who want to understand the relationship between their organization's activities and people's well-being. Or with anyone who has reporting or evaluation or impact somewhere in their job description and we think they look a bit like this. This might not be you. You might be in a central government department. You might have a team of evaluators around you, but you might commission some people who look like this. If you're in a local authority, you might commission some people who look like this. And I know there are some of you from third sector organizations and charities here, so this might apply to you as well. So this is our particular audience. It's, and I want to tell you about the content for it. So it covers quite a bit of what we've been doing today, but for this audience. So it talks about what is well-being and why should this particular audience bother measuring it. So we talk a lot about intermediate outcomes like we talked about this morning. We talk about measuring well-being, the steps involved. We give advice on planning and designing evaluations. And we talk a bit about the practical considerations of measuring and evaluating well-being. So this isn't evaluation 101. This is for people who have done evaluation. But we just pull out some of the particular issues around evaluating well-being. So for example, it's not unusual for the well-being of your beneficiaries to take a dip in the middle of an intervention or just after an intervention because your intervention is causing them to think about their lives and to kind of self-reflect and so on. So they might be kind of more self-aware about their well-being. So we talk about what to do when your evaluation shows things like that. We also, the main bulk of the guidance is we go through some recommended well-being questions to include in a survey or questionnaire. We recommend questions primarily on personal well-being from the Office of National Statistics, so we've covered those. We also look at other measures, other frameworks like WEMWEBs, which you might be familiar with. And we look at measures for intermediate outcomes or other outcomes or factors that are relevant to people's well-being that this audience might have an impact on. So for example, we look at good questions to ask if you're measuring social isolation, networks, self-confidence, resilience, engagement, things like that. We also talk about how to write your own well-being question and how to write open questions that are good for measuring well-being. One functionality, which I'll go into in a minute, is a survey builder. So this will enable you to create a survey to give to your beneficiaries. And then we have a section on analysing your results, which again is not analysis 101, it's just what are the things to consider when analysing well-being results compared to other results. So the features of the website, this is kind of just a very, very early design mock-up on the right. It's interactive, there will be embedded videos, and we'll give continuous support and feedback. So there'll be elements that go a bit deeper into some of the concepts, people in videos or in animations. There will be a single case study that goes throughout the whole guide that takes you through the experiences of an evaluator in a community centre. It gives you a progress tracker so people have a sense of being able to go through the guidance and learning as they go. And there is this ready-to-go functionality of a survey builder where you'll be able to, well, we're not quite sure how to do it yet, but from drop-down menus or from options, we'll be able to pull together your own survey, print it out, ready to go. And we think this will be very valuable for this particular audience. And this is where you guys might come in. What's particularly important is that we want feedback from this audience because in well-being, the well-being data is top-heavy, but very sparse at this level. And so it would be fantastic if we got more people at community and small charity level feeding into the database for well-being, and this will give us a much better picture of the national situation. So that's one tool I wanted to highlight. If you want to know when this becomes available, sign up to our evidence alerts and we'll send you a link. Other resources that we have already developed or are developing, we have our Measuring Wellbeing series, which we've talked a bit about throughout the days, and I'll show you some titles. These are discussion papers from academic and practitioner perspective, so it's a sort of slightly longer type of paper to look through. We have case studies of national, local, and project level to show good practice, but also the issues that people have come up with. We have sector perspectives, and at the moment, the one we've published so far is a wellbeing lens in the third sector. That was written by one of our partners at Arsenal in the community about how the Arsenal Foundation wants to incorporate wellbeing measures into their programs. We also have an expert network in our forum, and this is a great place to go if you have a wellbeing question or if you want to discuss today's course a bit more with some of the experts and share some information that you have or some good practice examples. And we also have, for example, some specific guidance on some tools. So the Office of National Statistics have created a slide set on how to implement personal wellbeing questions in your survey, and we have that available in our website. We also at the moment have a call for challenges in wellbeing evaluation open, and I'll go into that in just a sec. So this is our discussion series. This is Richard's paper here, which he mentioned this morning. Last week, this is the sector perspective on kind of well-being in the third sector, but from a football club point of view. We published Felicia Huppert's paper on multidimensional measures of well-being last week, and we're about to publish Paul Dolan's paper on well-being in the moment. So if you're interested in any of those other perspectives on measuring well-being, they'll be available soon. These are some of our case studies, which we've spoken about before, so I won't go into them, but they're all available we have a bank of case studies on our website. And this is what I want to just spend the last 5 minutes doing. We're really keen to know what real life examples of challenges of measuring well-being are. So I really want you to maybe talk to the person next to you, the person behind you, how you've been discussing things today. And just for 5 minutes, talk about the challenges you've had in your day-to-day work on measuring well-being. If you haven't started measuring well-being, tell me about the things that you're worried about will come up, the things that you expect to come up. And we'll do that for 5 minutes, and then we'll get a couple of people to feedback. All right, thanks. So if you've been able to have a bit of a chat, that's brilliant. Maybe if we just bring it back, and just so that we've got a bit of time to share with the rest of the room. Excellent. Okay, does somebody want to volunteer to be the first person to talk about one of their challenges or one of the things they're worried about? If you put your hand up, we've got a mic coming. Yeah?
Hello, Graham Wormsley, Department for Transport. My main difficulty, what we do is evaluate local road schemes, so road junctions, cycling lanes and things like that. My main difficulty is that I can't go out and survey people who are going through a road junction. So I'm starting to see from the presentations today sort of how you might get there. So you might do some sort of modelling along the lines of journey time saved or road safety or something like that. But I guess I just wanted to give that to you as an example of something that we could develop a complex model around life satisfaction. It would be quite away from the sort of survey design things we've been talking about.
Yeah, thank you very much. No, I think one of the things that we wanted to get across today is that there are very different stages at which you might be, and also very different approaches that might be appropriate. And modelling could be appropriate in some situations, something else might be more suitable for you. I'm definitely not an expert, I'm not going to give you an answer, but I think that you're definitely thinking along the right lines of saying, actually I've taken all this information, which bit of it is realistic or which bit of it is going to work for me. Has anybody else got anything they want to share? I think I saw a couple of hands up before. Yeah, go on in the front. If you just wait for the mic so that people can hear you. Thank you.
We were talking together. I work in a public health department, so my job is all about, promoting well-being. And one of the biggest difficulties is getting people to fill out any the basic data in the first place, whether it's talking to people or getting people to fill in questionnaires or whatever it is, that people really just don't like doing it, and project leaders don't like doing it, and so it's very hard to actually get quality data, off a group of people who are going through maybe a 12-week course of something.
Yeah.
So it's very hard, and we're not given any money to have special people come in to do it.
So the people who deliver the service are also doing the data collection. And were you talking it's not just well-being data collection, it's any data collection. Yeah, that is an issue, we all know that. And there are a couple of issues on top of that with well-being questions, because some people are not comfortable with answering well-being questions. But it's still very worthwhile doing, and I think there are ways around it, and there are ways of making it more simple. But I absolutely take that on board. That is a challenge that we've heard before. Anybody else? Yeah, just here.
Thank you. Alistair Johnson from DEFRA. One of the tasks that we're looking at is the promotion of natural capital, which is just another fancier way of describing the green and blue environment. One of the issues that we're looking at is around green infrastructure within urban areas. Now, we know that such infrastructure does deliver health, both in terms of physical and mental well-being improvements. It's just a question of trying to get a better handle on the valuation of those improvements, so that it's then possible to demonstrate to other departments that it's worthwhile investing in this infrastructure to the benefit of communities and individuals.
Yeah, absolutely. Valuation, very difficult task. Are others also in a situation where you need to convince other departments to come on board for it to make any difference?
But I'm not so sure it's as difficult as all of that. I mean, there are lots of studies now, mostly naturalistic, admittedly, and therefore there's elements of self-selection problems. But of the impact of green spaces on life satisfaction, we can give you some numbers that you may not have seen.
We have seen numbers. The issues then become encouraging people. If we put a green space within an urban, if we put a green space within an urban area which doesn't have any, is then trying how to encourage people to then use that space. How do we do that? How do they use it? In the different ways that they do use it, how does that then improve their physical and mental health? So yes, I agree, there's a lot out there, but we need a bit more.
Anybody else? No? Oh, yes.
Actually, could I exploit the previous question and ask whether DEFRA are looking at evaluating environmental policy outputs or outcomes in life satisfaction terms more generally than green spaces per se, particularly in the light of common agricultural policy related changes in policy as well?
Well, that's not a small question, is it? As you can imagine, there's a lot of change going on with a certain resulting from a certain referendum that didn't happen that long ago, and a lot of DEFRA's policies, about 80-85% of our regulation is EU based. So we are systematically going through all these regulations, including the Common Agricultural Policy, in terms of how we want to see the future look like. And as a consequence, we're having to see what the various options are and what benefits and costs that's associated with them. In terms of looking at them from a view that of well-being, as we've been discussing today, I suppose that's why I'm here. to see if that is a possibility.
Thank you. That was putting you on the spot a bit. But I think it illustrates that actually you're probably going to learn much more from each other than we've given you a chance to do so far today. So, and the coffee break is the perfect time to have those conversations. I'm just going to quickly go through what happens after the coffee break. So we're going to have a coffee break for 20 minutes. And then there are two options for half an hour, sorry. There'll be the Q&A for all those questions that you've been percolating for Martin and Paul in this main hall. When you booked your ticket for the course, some of you got the chance to book a ticket for a surgery session. How many of those people are in this room? A couple. 3, 4. Okay, a handful. That means that there are spaces in the surgery session. So the other option, so if you want to come back and ask questions for Paul and Martin, then you come back to the main hall. If you want to stay in the coffee room, we'll have some spots to fill for the surgery session. And we'll be going through some of these practical challenges and discussing them in small groups. And the kind of things that we're going to be looking at is wellbeing indicators at a local authority level, which I'll be talking about. We're going to talk about more generally about what to measure, what's suitable to measure in which circumstances for what project. We're going to talk about workplace wellbeing. And we're going to talk about modelling approaches with Liam, who's the guy who did the modelling for the Housing First. So if you have any questions about the Housing First, you could also come to that. So if you come and find me or Sarah during the coffee break, if you'd like to attend that practical session afterwards. All right, otherwise come back here in half an hour. Thank you.